You are listening to Belly Birth Beyond with Pelvic Floor Mama. I'm your host, Becca, pelvic rehab certified coach and mom of two. Welcome to the safe space where no topics of motherhood are off limits and judgment is left at the door. Too many mamas are dismissed when they've got valid concerns. If you're sick of hearing that's normal when it feels otherwise, keep listening. Welcome back, mama. We are going to talk pregnancy pain. If you feel like your pubic bone is ripping apart, your hips on fire, your back is going to give out on you, your vagina is going to fall out, you're tired of leaking every time you cough, sneeze, you're crossing your legs, you're wearing a pad, then this one's for you. Because all of these things are so common, but not normal, which means they can be helped. So when you are getting dressed and you have a hard time putting your pants on or your underwear on, it can be helped. You shouldn't be like, yeah, maybe you can't reach your feet. That's common. Your belly might be in the way. But having pain when trying to do so is not okay. Not wanting to roll over in bed because you feel like your pubic bone is being ripped in half or your groin is being ripped in half, not okay. Not getting good sleep because you're constantly tossing and turning and you can't find a comfortable position. Guess what? I can help you with that. That is right. Pregnancy pain is so common, but that does not mean it's normal and it doesn't mean you have to suffer. It's one of my biggest pet peeves is hearing it's normal, just take Tylenol, use a heating pad, get in the warm bath, get a belly band, etc. And the reason why these are pet peeves of mine is because sure, they might work for a short period of time, but they aren't taking care of the problem. And you're like, I'm pregnant. That's why I'm having pain. No, that is not. Yes, you are pregnant, but that doesn't mean that pregnancy was intended to be painful. It's not just the fact that you're pregnant and so now you're having pain. It's not just the fact that you have relaxin and hormones coming through your body, so now you have to have pain either. It's not because you have growing pains or your belly is getting bigger. All of these things are factors, but they are not the cause of your pain. Okay? Growing pains they're an excuse. Your belly getting bigger is an excuse. Just being pregnant, these are all just excuses and ways to dismiss you and your pain and invalidate what you are feeling. Let that sink in for a minute. Invalidate what you are feeling. Pregnancy pain. There is such a thing as pregnancy without pain. There is such a thing as pregnancy pain relief. So where does this pain come from and why is it happening? The pain comes from your body needing a little support. Something. Pain is your body's way of saying, hey, pay attention to me. I need some help. That's why pain is never normal. Pregnant, postpartum, and anything else. That's what we're focusing on here right now. But we can go on about all the other things that women suffer with in pain, and they're just brushed off as normal. But today it's about pregnancy. So it's your body's way of telling you it needs a little support. What does that look like? Okay. You are growing a human. Your body is changing. So you need to be able to, your body needs help in supporting these changes. And just having relaxin and it's what it's supposed to be, and this is just how it's going to be. It's not going to get better. It can't get better because I'm just going to get bigger. These are all just limiting factors that you are believing because for decades, probably longer, women have just been dismissed by their providers, by family members, by friends. And the thing is, hey, my best friend just went through pregnancy and had the worst pubic pain. She said she went through it and she made it. So now I just have to kind of suffer through it. Do we really want to just suffer through things like that? Don't we want better for our friends and our family? Even if we had to go through something like that, wouldn't we want someone else to not have to go through that if that was possible? That is what's happening. Is it's just becoming so normalized that it's like desensitized. So now you're suffering in pain and you are no longer feeling like yourself. You're feeling like dismissed, you're discouraged, you're not sure if you're going to make it X more weeks. You don't know how the heck you're going to give birth because you're in pain now. But then on the other hand, you're like, I'd rather give birth and be in that pain than the pain I'm in. And you think just having your baby is the reason is going to cure your pain and it's going to solve your problems. But it's not. So we're going to dive into this. Pregnancy pain, what does it come from? It comes from just your body needing support, meaning we all have imbalances in our body. We do things one-sided. We do repetitive activity. We sit for a long period of time, or we're on our feet all day. Whatever it is, it's consistent. And when you're pregnant, your body is showing you that you have this imbalance taking place. And so it needs some support, which is usually coming from your core, your pelvic floor, and your glutes. But the problem with our glutes is you often are clenching your butt and they're not working how we want them to. So they become these super tight muscles that now pull on things. And now we have sciatic pain, or we have this numbness down our leg, or we have this sharp stabbing pain in our butt cheek, or our SI, or the back of our pelvis, feels like it's every time we step, our leg's going to give out on us. And that's what's happening when we have really tight glutes. So it's addressing all of these things as one. Okay. You go and you talk to your provider, or you're in a Facebook group and you're asking for help, and they're giving you the answers of take Tylenol, hot bath, belly band, and this and that. Cool, but that doesn't actually help my pain. It comes back within a few hours, or a few 30 minutes. Or it's just getting worse now if I don't wear the belly band, or if I don't do those things. And the reason why are because those are all Band-Aids. They're not actually fixing the problem. And so if you think about it, if you're sitting here now and you're like, well, I'm like 32, 33, 34 weeks. I only have a few left. It'll be fine. I can make it. I made it this far. I'll just give birth and then I'll feel better postpartum. But we just talked about your body isn't necessarily just going to feel better postpartum. How many mamas are leaking postpartum? They are peeing themselves. They have no control over their bladder. Whether they cough, sneeze, stand up, lift the car seat, or they have significant pain with sex where they can't even have sex anymore. And maybe you don't want to at this point because you're touched out, which if that's the case, you should go listen to the episode with sex coach Casey, where we talk all about this. But then that's a problem. How many mamas do you know, maybe including yourself, that have back pain postpartum? And you have a hard time carrying your child or lifting your child or just getting through the day without feeling like your back is going to cripple on you. Your hips are burning. You still can't sleep on your sides. Your pubic bone still feels like it's ripping in half. It's because the problem was never addressed during your pregnancy, which means it's still a problem now. You are just no longer pregnant. Some moms are like, yeah, I had it for a few weeks or a few months postpartum, but now it's better. Other moms still have it years later. Yes, years. And if there's another pregnancy, the reason why the second pregnancy or the third pregnancy is told that it's more painful is because the problem was never addressed. So now you have another pregnancy and your body's already tried to tell you it needs help. So now it's like it needs help sooner. So now you're sitting at 12, 13, 14 weeks and you're like, wow, I have this pain already. I didn't have it until I was 28 weeks last time. And it's way worse than it was the first time. I don't say this to scare you. I say this because there is a reason for your pain, and your body is telling you it needs help and support. Just ignoring that and having your baby it's just an excuse. It's just prolonging your discomfort. And physical pain, I know how much that can lead to mental and emotional just drainage, exhausted, burnt out. You don't feel like yourself. You don't want to do things that you used to want to do. And if you wait till postpartum, now you have a new baby to take care of, and you don't have the time to take care of yourself, or you don't know how to take care of yourself. I have been there. I have been in your shoes, and it is not a fun ride to be on. So instead of just waiting for your baby to be born and hoping for the best, find relief now, because pregnancy without pain is a thing. Pregnancy pain relief is a thing. It is the entire reason why I created Secrets to Releasing Pregnancy Pain. Guess what? The secrets aren't really that secret. Teaching you how to do things like get dressed, roll over, stand up, pick up your other children, get in and out of the car. Do the things that you do every single day that are causing you pain, but be able to do it without pain, or being able to do it without increasing your pain. Because the problem is you continue to increase your pain over and over. So by the time you get to the end of the day, you're at a 10 out of 10. You're at a 15 out of 10. You're like, I'm done. Get this baby out. I can't do this anymore. And then you try to sleep and you can't because you're tossing and you're turning and you can't get comfortable. And then you have to waddle your way to the bathroom while you're holding onto the side of the wall to make sure you make it there safely. And then you climb back in bed and you do it all over again. It doesn't have to be like that. In pregnancy, sleep can actually be better. It can get better. Yes, there's some insomnia, there's some tossing and turning, but the pain and the having to pee every 5 minutes can be helped. One of the most common responses I get from moms who take my free class, who take my program, who grab the free guide, all of those things, and the number one response is, I'm sleeping so much better. Because what you do during the day affects how you sleep at night. If you have all this pain and discomfort and stress in your body and you try to lay down and it tries to relax and let go, you're having more pain and you're having a hard time getting comfortable. But if you do a little bit of movement throughout the day, intentional movement, the right movement, not the movement that's increasing your pain, okay? The right movement. I had a provider who, bless her heart, tried to be really helpful to a mom who had pubic pain, gave her some exercises to do, and this mom did them and said, I'm getting worse. And it's because it wasn't the right movement for this mom. It was making her pain worse. Especially with pubic pain, you have to be careful about what movement you do. You have to find the right movement. And that's where I come in. I teach you the right movement for you. And it doesn't mean that you have to find a daycare, you have to find a sitter, you have to take PTO, you have to drive somewhere. You can do it all from the comfort of your own home by just giving yourself 5 to 10 minutes a day. A day. Couple minutes in the morning, couple minutes throughout the day, couple minutes before you go to bed, and you will be amazed at how much better you feel. Most moms find relief almost immediately. And almost all of the moms find relief, some sort of relief within the first 2 weeks. So if you're one of those moms sitting here at 33 weeks pregnant, imagine in 2 weeks from now, you forgot you had pain. You forgot you were tossing and turning all gosh darn night and couldn't get a wink of sleep. That's what it is like to work, to take Secrets of Releasing Pregnancy Pain. That is the whole purpose of that. Because I don't want to see you suffer in pain throughout your pregnancy. Fear labor. Can we ditch the fear of labor? What if you felt prepared for labor? What if you felt ready? You understood what was going to happen and how to help yourself. You could control the things that you can control, and you know like what's coming next. You can limit the risk of like an episiotomy or a cesarean, potentially an induction, by helping support your body. What if you had support postpartum? I know so many moms talk about how pregnancy feels so lonely. And maybe I'm the oddball out, but postpartum felt so lonely. You're constantly taking care of this baby. This baby wants you all the time, especially if you're nursing. You don't know how to take care of yourself. You don't have the time to take a shower. How are you going to have the time to heal your body if you're already having pain and discomfort? And when are you going to do it? Are you going to continuously put yourself on the back burner? When are you going to say enough is enough and I deserve to feel good too? Because you do. You matter. It is not all about your baby. Your baby is important, but you matter too. You are a whole gosh darn person. You matter throughout your pregnancy. You matter throughout your birth. It should not be an experience that happens to you. It should be your birth experience. Your postpartum, it's not just about coming to see baby. It's checking on you physically, mentally, and emotionally. Postpartum depression exists. It's real. Postpartum anxiety is real. And it's so often we place all of the burden on you. And now you're taking care of this human and you don't know how to help yourself and what support to ask for or who to ask for help, even if you have a village around you. So let's start with pregnancy and let's start with the pain that you're having right now. And let's have you feeling a little bit more like yourself. And let's have you feel prepared for labor and birth so you can have the birth that you desire and that you wish to have, or you have more control over that. You can minimize tearing, which would improve your recovery. What if you could have a good recovery where things just felt right? You weren't constantly wondering, is this normal? Is this okay? I don't know where to go from here. That's not how that should be. That's what I got for today. Pregnancy pain. Don't suffer with it. It's so common, but it does not mean that you have to sit there struggling to make it through your day or struggling to make it through certain activities. You can feel relief. With Secrets to Releasing Pregnancy Pain, I guarantee you relief within 2 weeks. Truly. That's how confident I am with that program and with the tools I teach you. For being a podcast listener, a nice loyal podcast listener. I'm not doing discounts very much anymore, if at all. But for being a podcast listener, you can use the code podcast and you can get a discount if you're interested. And the Mama Bundle is secrets to releasing pregnancy pain, which is pregnancy relief within 2 weeks. You are also getting pelvic power labor done right, which is feeling prepared for labor and birth, minimizing tearing, and medical intervention. And then you're getting postpartum support. Don't do it alone. The biggest takeaway from this is you matter, your body matters. It's not just baby. That is a huge importance. We want your baby to be safe. We want you to be able to hold and love on your baby, but you matter too. Your physical, mental, and emotional health matter. And that's one thing you'll always get from me, is asking how you are doing. I love the baby pictures. I love hearing about how they're doing, but how are you doing? Because who is checking in on you? It feels lonely sometimes, but it doesn't have to. I'm going to put some of the information down in the show notes below. You can find some links there. You can find the discount code there. If you are dealing with pregnancy pain and you're not sure where to start, grab my free guide to manage pregnancy pain. Free guide. Grab it. Start doing that. So many moms just need that and they feel better. And I get messages all the time. That changed my whole pregnancy. I can actually enjoy it now. I'm getting better sleep. It's amazing. That can be you too. If you want to do one thing, grab a stability ball, a big yoga ball that you sit on. You want about 65 centimeters, depending on how tall you are. Average for most moms, I say 65 centimeters. And use that. That is such a powerful tool for pregnancy, managing pain, getting your baby in a good position, preparing you for labor. Heck, you can use it postpartum even. It is a great tool. If you have one, bust the dust off, clean it up, bring it upstairs, have your husband or your significant other put some air in it and start using it. If you're not sure where to start, head to my Instagram page. Take a look at some of those videos with a stability ball. Pain relief exists and it's not far from you. If you truly want to change how you feel during your pregnancy, I am here for you. You can do it. You just need a little guidance to know what to do, finding the right movement. It's just quick, attainable things throughout your day. You'd be amazed at how simple it is. Relief within 2 weeks with Secrets to Releasing Pregnancy Pain, or grab the Mama Bundle and get everything you need. Lifetime access, community support, private calls, all for you. Don't suffer in pain. It's time to end that. Have a better postpartum experience. Enjoy those newborn snuggles without wondering if your groin is going to rip in half or your vagina is going to fall out. We're done with that. Or maybe we're not. That's a decision you have to make. But that's all I have for today. I hope you have a wonderful day. I'll catch you next time. Nothing is TMI when it comes to motherhood, and common doesn't necessarily mean normal. Always trust your gut and never stop advocating for the care you deserve. If you enjoyed this podcast, help it reach more mamas like you by subscribing and leaving a review on your preferred listening platform. Keep in touch with me on Instagram by following Pelvic Floor Mama. See you next time.